There's a new warning tonight about the highly contagious variants and fears they could drive a resurgence of COVID-19 infections across this country. New modeling shows there are fewer than 33,000 active cases in Canada right now, a 60% drop compared to a month ago, and deaths are down 58%. But the spread of dangerous mutations threatens to reverse that progress. Canada's Chief Public Health Officer says a more stringent approach is needed.
Current community-based public health measures will be insufficient to control rapid growth, and resurgence is forecast.
In January, at the peak of the pandemic, Canada had 8,000 cases a day. Now factor in the variants, and Dr. Tam predicts we could have 20,000 cases a day in a third wave. This is a frightening picture as vaccine distribution finally ramps up. Abigail Bimman has our top story.
Can everybody hear me? Just wave if you can hear me.
World leaders at their first virtual G7 meeting. They're just like us.
Can you hear us, Angela? That's okay. That's all right. I think you need to mute.
Prime Minister Justin Trudeau attended the event hosted by the UK, where COVID-19 cases have been falling after grappling with a more transmissible variant.
These variants have been smoldering in the background and now threaten to flare up.
Here's how variant cases have been climbing in Canada. New modeling shows case numbers, hospitalizations, and deaths are all falling across the country. The exceptions, Newfoundland and Labrador, where the spread is blamed on a variant, and Nunavut, but no variant cases have been found in any territory so far. The country's top doctor warns if variants spread and public health measures are lifted, cases could hit 20,000 a day next month. Compare that to the latest daily total, 3,300 new cases.
A resurgence is very likely if people let go of the public health measures right now.
We could see a third wave that is even worse than the second or the first.
Given many provinces are lifting restrictions as case numbers fall.
The premiers and I spoke last night about not opening up too fast.
The Prime Minister was asked if he told any of them to slow down on that call. He didn't answer, saying it's his job to support provinces.
We need to make sure that even as provinces look at loosening up certain restrictions, that other restrictions are kept in, and that there is an ability to both respond quickly when variants appear, and also an ability to use rapid tests.
Dr. Tam said any reopening needs to be done carefully and only if sequencing, testing, and contact tracing are all in place. Robin?
Abigail Bimman in Ottawa. Thanks, Abigail.